Welcome back to Medinare. In this video, let's discuss about Winter's line. We all have experienced that pain or even heard about that immense amount of pain that the last molar teeth, also known as the wisdom teeth, would give us. If erupted partially in the oral cavity, some third molar teeth couldn't fully erupt in its normal location by its expected eruption age, and we call it impacted teeth. So these teeth go for surgical extraction. Different levels of impacted teeth would end up with various difficulty levels of surgery. And before initiating the procedure, we need to do clinical and radiographic examinations in order to assess the difficulty level. This is not a new concern, but way back in 1926, George Winter faced this situation and gave us three imaginary lines which can be plotted on a standard periapical radiograph. So now we know why we call it Winter's line, right? In 1971, Howe popularized this Winter's line in order to determine the difficulty index of surgical extraction of mandibular third molar. It is used to determine the position and depth of the impaction by taking an intraoral X-ray or lateral extraoral X-ray or even OPG, and the tracing of the three imaginary lines can be done, which George Winter told previously. Okay, now what are those lines? We call it war line, where W stands for white line, A stands for amber line, and R stands for red line. Let's start with the white line. White line should be drawn on the occlusal surface of first and second molar, and it should be extended posteriorly to the third molar region. It indicates the difference in occlusal level of second and third molar. Next, we have the amber line. It represents the bone level. This line is drawn from the crest of the interdental septum between the molars, and it extends posteriorly distal to the third molar, or you can extend up till the ascending ramus. This line denotes the alveolar bone covering the impacted tooth and the portion of the tooth which is not covered by the bone. Lastly, we have the red line, which is drawn perpendicular to the amber line. It is drawn till a point where you apply the elevator, which should be imaginary. Lastly, we have red line. It is drawn perpendicular from the amber line to an imaginary point of application of your elevator. It indicates the amount of bone that will have to be removed before elevation. That is the depth of the tooth in the bone and the difficulty encountered in removing the tooth. So based on this, we have the difficulty index. So if the red line's length is between 3 to 4 mm, it is minimally difficult, so it becomes easier to extract. If it ranges from 5 to 7 mm, it becomes moderately difficult. But if the red line's length is 7 to 10 mm or even more, it becomes very difficult to extract that impacted tooth. That brings us to the end of the video. I hope you guys found it helpful. Do like this video and subscribe to Medinare for more. Thanks for watching.